Now we're moving to the next vein, which we are discussing its anatomy, and this is what is known as the posterior interosseous vein. Posterior interosseous vein. Okay, so for the posterior interosseous vein, let's look at this. Let's look at the image, trying to, okay, of course dorsal interosseous is posterior interosseous, dorsal is at the back, posterior is at the back. So but this is a better picture trying to show the posterior interosseous vein. So it's actually part of the deep venous system of the forearm. It accompanies the posterior interosseous artery. Okay, so if you have a picture that is showing both arteries and veins, you usually see them going together. So they are found in the posterior compartment of the forearm, and they drain blood from the extensor muscles, and ultimately they join the brachial veins via the common interosseous vein. So moving, origin is formed by venous tributaries from extensor muscles of the forearm, runs alongside the posterior interosseous artery. Okay, so cause that ascends to the posterior compartment of the forearm deep to the extensor muscles. It travels between the radius and the ulnar, between the interosseous membrane region. So it joins the common interosseous vein, which now drains into the brachial veins. Okay, the brachial vein there. So tributaries receives blood supply from the extensor digitorum, extensor carpi, radialis, longus, and brevis, extensor carpi ulnaris, extensor pollicis, longus, and brevis, extensor indicis. Okay, then also communicates with the superficial veins via the perforating vein. So drainage and the structures it supplies: it drains the posterior compartment of the muscles of the forearm and contributes to the venous return from the deep venous system of the upper limb. Okay, so what next? So that clinical note is important in deep venous drainage of the forearm, also communicates to the superficial veins, can be involved in deep venous thrombosis, and is relevant in vascular surgeries.